Good morning, and thank you for joining us at the 2012 ACVIM Forum and the 12th Annual Animal Survivor Media Event. I'm Dr. Sandy Willis. I'm an ACVIM board-certified specialist in small animal internal medicine. I am currently on the development committee of our giving arm, the ACVIM Foundation, and past chair of the ACVIM Communications Committee, the committee that hosts Animal Survivor. The mission of the American College of Veterinary Internal Medicine is to enhance animal and human health by advancing veterinary internal medicine through training, education, and discovery. The ACVIM was established in 1972 and is the international certifying organization for veterinary specialists in large and small animal internal medicine, cardiology, oncology, and neurology. The ACVIM Forum, taking place today, this week, 2012 in New Orleans, is our continuing education meeting where we present cutting-edge information, technology, and research abstracts showcased for the veterinary community. We have in attendance an international crowd of specialists, veterinary generalists, technicians, veterinary students, and some of our candidates that are interns and residencies in our training program that are sitting the exams here to become ACVIM board-certified diplomats. The ACVIM's more than 2,000 active members are ACVIM diplomats. In addition to completing undergraduate training and 4 years of veterinary school, board-certified veterinary specialists are similar to their human medical counterparts in that they have completed an internship and residency in their specialized field, an additional at least 3 to 5 years of training beyond veterinary school, and then they must pass rigorous examinations to achieve board certification with the ACVIM. And some of those exams were taking place prior to this forum, and this is done every year. Specialists bring greater understanding in the area of internal medicine, cardiology, oncology, or neurology, and have a greater knowledge of the unusual, the uncommon, or rare in both large and small animals. And we treat everything from dogs, cats, to cattle and horses. In addition, a specialist has the additional diagnostic equipment not generally used by the family veterinarian, and they may be able to offer 24-hour monitoring in their referral hospital. As you will see in our animal survivors here today, specialists work as a team with the family practitioner. It's really a triangle of care with the owner, the specialist, and the referring veterinarian. In each of our survivors, the family veterinarian referred the owner to a specialist for their expertise and additional diagnostics. Animal owners are encouraged to work with their family veterinarian for referral to an ACVIM board-certified specialist in the area. Referral is preferred because records from the family veterinarian are highly important to the specialist, and the specialist relies on the family veterinarian for follow-up care. But owners can request themselves a referral from their family veterinarian, and they can find a specialist in their area and self-refer. Animal owners can find a specialist in their local area by going to our website, www.acvim.org. All this said and done, pet owners and the public are generally still fairly unaware of specialty veterinary medicine. And this is why 12 years ago, the ACVIM created Animal Survivor. Who better to tell the story of specialized veterinary medicine than the pet owners themselves? Who better to show the story than their beloved pets? And who better to spread the word than the media? Spoken, written, TV, and now we have the wonderful internet. What becomes abundantly clear is the bond that people have with their beloved pets. Whether small or large, the partnership of owner, family veterinarian, and specialist to care for the pet, and the quality of life of the pet through the treatment. The oft-heard phrase, "I don't want to put my pet through that," rings really hollow when you look at these pets. Our animals' lives are so short that their treatments have to preserve quality of life, or we have to look for another treatment. We may be killing the cancer, but if the pet isn't doing well, we need to change therapies. Today we are here to honor amazing animal survivors who beat the odds because of advances in veterinary internal medicine. With the help of their owners, a general practitioner, and an ACVIM board-certified veterinary specialist, these animals overcame life-threatening illnesses to lead a healthy life once again and wag their tail up the yin-yang. Angel there. Each animal has an amazing story of survival made possible by specialty veterinary internal medicine. This year we have 5 wonderful survivor stories from the New Orleans area. 4 of them are with us today, and what I'm going to do is introduce each one, and then we have a wonderful video that's taken in their hometown to really showcase their story, and we'll have the pet owners come up and talk a little bit about each of the pets, and we'll make sure we get lots of footage on each of these wonderful doggies. We have Angel, Bailey, Penny. We will talk about Rocky, a special horse from the New Orleans Police Department. And Camille, our kitty cat, will show her video, but she had other things to do today and couldn't attend. That would be the cat. So we'll show Angel's video. Angel is a Carolina yellow dog, a.k.a. American Dingo. She's over there on my left. And she's with Christy and Johnny Sullins, her owners. Dr. Catherine Garon, an oncologist, and Steve Suiters were involved from the ACVM diplomat side.
Come here. Come on. Good girl. What's it? Good. Okay. Angel is a dominant female, and she never backs down from anything. If something's happening, she will be like a fireman. She'll go into the fire while everybody else is running out, kind of thing. One day we were doing Poochie Pilates, which is something we do in the bed every day, and Johnny was rubbing Angel's belly, and he came across a lump, and he said, "Hey, oh my gosh, there's a lump."
It shocked me. It floored me.
Yeah.
And seeing something like that it takes the breath right out of you. Even thinking about it right now, it's very jarring. You don't know what to think. You don't know what to do.
So we took her to the vet, and they gave us medication in case it was an infection or something like that. And they did a test. Test came back negative for cancer. So we waited 2 more weeks. The lump never went away. We took her back. They tested her lump again, and then it came back positive for lymphoma.
At that point, she referred us to a specialist that could do the staging and treatment if we chose to do that.
Lymphoma is the most common cancer that we see in our dog, and is also the most responsive to chemotherapeutic agents. We talked about remission times and prognosis, and that the fact I was not going to cure Angel with chemotherapy. I had a 80% chance of putting her into complete remission, and that complete remission time would be somewhere average of 9 to 12 months. But at some point, the cancer was going to come back.
Obviously, we wanted to do whatever we could. So then Johnny said, is there a cure?
Yeah, we were kind of hoping for a cure.
That's when I offered them or told them about Dr. Steve Suiters' bone marrow transplantation at North Carolina State University. And at that time, they had about a 30% cure rate. So the only cure I could give them was a bone marrow transplant.
It cost $16,000, and we would have about 7 months to raise the money.
We were broke to start with. I mean, it was...
to be honest.
Really, we put our wedding together ourselves. We paid for everything, so we thought we'll wait on the rings and things like that.
And we'll do the honeymoon afterwards.
Then Angel was diagnosed with cancer, and so anything extra we had, thank God there was something extra from Johnny's job that we were able to afford the chemo.
I think it was when I was at work on Monday that I called up Christy, and I'm opening up a checking account. We're going to call it Save an Angel. We're going to get this thing going, and we're going to raise the money.
We ended up doing the full 25 weeks of chemotherapy, and at about that same time, they had acquired through fundraising events the money they needed for the bone marrow transplant. And according to Dr. Suiter, at the 6-month mark after the bone marrow transplant, if she was still cancer-free, they considered that a cure. But we only had about a 30% chance that we were going to get to that point. And Angel was lucky. She's one of the 30%. And here we are, almost 3 years out from the date I met her.
We would just be sitting there talking about it, talking about her story, and someone would just come up and hand us money. And even after Angel got back, just because they wanted her to succeed. Like, everybody wanted her to make it. Out of all of the hundreds of dogs that come through the clinic that die from lymphoma, Angel's the one that actually had the chance to make it, and she did.
The donors are really what make the difference. If it wasn't for them, Angel wouldn't be alive.
So then we said that we were going to give back. If we could save Angel, we would give back. And so that's what we've done.
Their fundraising efforts ended up creating a nonprofit organization called Save an Angel, and Christy is just phenomenal in her efforts.
It's not just the quality of life, it's an actual life, you know? We have life here. She's still alive, she's great. You know, it was a lot of work, but it was really worth it. So maybe not everybody has to go through all of that work now that we've kind of done some of this. Maybe it will help other people to raise money more easily or to get bigger lines of credit or, you know, whatever.
And it changed our life forever.
You guys want to come up and talk a little bit about Angel? Sure.
Hi, I'm Christy Sullins, Angel's mama.
And I'm Johnny Sellens, her daddy.
I'm kind of cheating off of our brochure here just because it hit the main points. Like Dr. Guérin said, canine lymphoma is one of the most common canine cancers, and the cure rate is 0 to 3% with chemotherapy alone. And to us, it seemed unacceptable to put her through all of that with no hope in sight, basically. And it turned out that we weren't really putting her through anything. I mean, after it was all said and done, I think that the hardest part of Angel going through this was probably the radiation through the chemotherapy. But other than that, I mean, she sailed through. She was great through chemotherapy. She did fine during the bone marrow transplant. She ate like a pig. I mean, she was happy, went to the dog park. She wasn't supposed to go to the dog park.
She went squirrel hunting a few times.
Yeah.
Not supposed to do that either. Had to keep her spirits up, right?
Right.
But
So,
yeah, I mean, the chemotherapy to her was like a Long Island iced tea. It wasn't really anything, you know. After about a day of grogginess, she bounced right back, which told us that she wanted to fight, and we wanted to fight for her. That was our decision. She had already made the decision pretty clear for us. She wasn't going to give up if we didn't give up. So that's when we decided that we were going to raise all the money for the bone marrow transplant that would ultimately save her life.
because if there is a way to cure her out there, then why not take it if the only thing standing between us was finances?
Mm-hmm.
So then we realized that there was such a great need. Gosh, I'm so used to, we're used to people asking us questions. I'm really sorry.
Yeah, we found out that at the time, there's a lot of pet insurance out there right now. And we had gotten the standard plan for her and her boyfriend, Romeo, now husband, by the way. And we got in the standard option because they were 5 years old. Statistically, we thought we were in the clear. We didn't get a cancer rider or anything like that. Unfortunately, she did get cancer. So we were covered for a few of the lab fees and that sort of thing, but not really making a dent there. So the chemotherapy is pretty expensive. You know, every pet owner needs to think about that and the finances and, you know, whether or not it's the right option for their dog.
Ask yourself the question, if I'm sitting in front of the specialist and they're telling me that I have to have $10,000 to save my dog's life, what are you going to do? Is it going to be worth it for you to put out that $30 to $50 a month to protect them so that you can actually save their life? Or is it just something that you just let go and then you have to pay it out of pocket and perhaps lose your pet? Because, you know, the options are expensive right now. Hopefully it won't always be that way and this will be available for everybody, but for now that's the way it is. We also like to talk about the importance of checking your dogs for lumps. You know, while there is no prevention, obviously, but it is important to stay on top of it because early detection is critical, just like with humans. So with it affecting dogs at the same rate as it's affecting us, I think that we owe it to them to be checking them often, more than often.
So find your own form of Poochie Pilates.
Yeah.
Check them for lumps, stretch them out, keep them limber.
Right. So now Angel's doing fantastic. You know, she went through the bone marrow transplant. Like we said, chemo was a breeze. She went to NC State where they treated her like royalty. She came back, she was tired. Like I said, the hardest part out of everything was her having to go into isolation and to, get through the radiation part, which was about 5 days of just really, really scary. They had to give her blood transfusions and things like that, which sounds a lot worse than it actually is, because by the end of it all, she ended up coming out of it with flying colors, so it was all worth it.
Yeah.
She wasn't traumatized. She came back actually so spoiled that we had to hand feed her. I was calling the nurses, like, what did you do to my dog? Like, she won't eat. And she was used to getting, chicken, and everything was hand fed and stuff like that. So
she got spoiled.
So she got spoiled, and now her energy is back up, and she's a role model for all the foster dogs that come through our home. And had we not done this, then we wouldn't have learned, Angel being diagnosed with cancer was the best thing and the worst thing that ever happened to her.
Yeah. Now she ages like Benjamin Button.
Yeah.
I'm kind of thinking about getting a bone marrow transplant myself.
Yeah. So we believe in it. We believe in the process, and even though it is frightening and it is expensive, it is definitely worth it. And thank God there are specialists out there that are continuing to work hard to find better answers for dogs like Angel, who are diagnosed with something that's so common. And if we can help it, then I think it's in everybody's best interest to make it more readily available to other people, other animals.
Yeah, and maybe some other pet cancer parents don't know this, but 100% of the transplants performed on humans came from dogs, so we know that it works on them. In fact, this procedure was one of the first opportunities given back to dogs, the cures that they help provide human beings every day.
Right.
So we knew it would work. In fact, the machine that saved her life was donated from the Mayo Clinic. They didn't even have to do anything to it. They just plugged it in the wall, plugged it into Angel, and it worked. I'm just kidding.
So it's, yeah. Is that good?
Mm-hmm.
Okay,
Thank
great.
you all.
Thank you all so much for having us.
I love the oncology stories because I talk to veterinarians, generalists, and certainly pet owners that say I would never treat cancer in my pet. And these folks a bone marrow transplant is still very, very rare. But even if a pet owner goes to an oncologist and decides not to do treatment, maybe not at all, or maybe do something, an alternative treatment, they've gone to an oncologist specialized in cancer therapy to be able to find out what is available and get some information about prognosis and quality of life. So referral is not always about all the other treatments and diagnostics. It starts with the office call with that specialist. And that may be as far as it goes, but that second opinion, which oftentimes just supports the general family veterinarian, is hugely important. We're going to mix things up a little bit here because we're very lucky that Camille sent her owner here. Camille, of course, as we mentioned earlier, our kitty cat, a little calico that suffered from hepatic lipidosis because she was left alone after Katrina, which was a common story. We mentioned earlier that she just had other things to do today, and that would be the cat. But her owner, her new owner, Christy Mateo, who's the technician at Louisiana Vet Referral Center, and her small animal internal medicine specialist, Dr. Kenneth Arsenault, are both here today. So without further ado, let's tell Camille's story on video.
My name's Christy Mattea, and I work at the Louisiana Veterinary Referral Center, Mandeville, Louisiana. This is Camille, and I love her because she has so much personality. She's the sweetest cat, she's friendly, the kids love her, she's a great family pet. I met her here. I was working at the Veterinary Referral Center. I just started right before Katrina. Katrina hit, and she came in through us, through our emergency department.
In August of 2005, Hurricane Katrina came in. I think a lot of people were caught off guard because history has told us hurricanes come 3 days later, you're kind of at least back into your house and trying to get your yard back together. It was a week until I could get back. And again, I wasn't even in the hardest hit area, like in New Orleans, where there were floodwaters that were still so high. Really, the inside of the building was fine, but the storm pushed the facade off, so there was this probably 8-foot pile high of just bricks looking in front of the clinic. The building was still fairly well intact. But it was a really stressful time, and it was something that we'd never experienced here. So after the week when I got back here, we all met here, and we were really the first clinic to open.
Camille came in
About a month or so after Hurricane Katrina, she had been in a house in Slidell, Louisiana that had flooded, and she had been there alone for 4 or 5 weeks. Her owners had evacuated out of the area, and she was brought into us by an organization called Noah's Wish, who was stationed here after the storm and was instrumental in rescuing a lot of animals that had been stranded. She was very thin, she was jaundiced. Her coat was in really poor condition.
So when they brought her in here, we knew that she had, like many of the cats we saw during that time for the first few weeks to months after Hurricane Katrina, we had a lot of cats with hepatic lipidosis.
Hepatic lipidosis occurs when a cat goes into starvation. They shift into this different type of metabolism. The fat stores move into the liver, and their liver becomes filled with fat. And so the ability for the liver to work and function decreases, so they can actually ultimately go into liver failure if they're not treated appropriately and aggressively.
So in Camille, at that time, that's what we placed in her, was a tube. And so it's called the PEG tube, percutaneous endoscopically placed gastrostomy tube.
It goes down their mouth into their esophagus, into their stomach, and then we're able to make a small incision through the stomach and pull it out through the stomach. So it actually sits on their side. You can feed them straight into the tube. You can give them medication straight into the tube, and they tolerate it very well.
Her PEG tube was in place for about 3 weeks, and she started eating on her own. And the goal is, once they start eating on their own and their blood work returns back to normal, then you just start tapering the feeding. 80 to 85% of cats with this disease will respond to treatment, to aggressive nutritional, as long as it's started early. And at that point, those animals are considered to be cured from the disease. And one question people ask, well, will it recur? There was one study that looked at, I think, 180 cats, and only 4 of them out of the 180 that had hepatic lipidosis had recurrence of the disease. So it's not something that we see recurring often.
She's healthy today. I've just recently checked her blood work. She came in for her annual exam and vaccines, and blood work came back fine. All her liver values are normal.
Christy Matea has been a technician here for a number of years. She has a very fond affection of pets, as most of our technicians that work for us. I mean, they're great pet owners. When she found out that the owners were not moving back to the area, she contacted Noah's Wish and decided to adopt her.
You know, I kept seeing her every day she was here. I just fell in love with her because she was so vocal. I would go open her cage door and she would come right to me, and I would pet her and she would talk back to me, and just fell in love with her.
I hate thinking about all that Katrina time, but I love seeing Camille because that was great. She came through. She's a ray of light, and she's a great cat, and it's a great story to be able to help her and still know her, and we know we did good things for her.
Hello. Well, I'm not really prepared for this, but Camille is she's an amazing cat. She went through being so sick so fast, pretty much starving without any food for 3-4 weeks. She came in through our emergency department. She transferred to our internal medicine department. Dr. Arsenault took over, placed the PEG tube, and she was just so strong and so amazing, and I just fell in love with her from the start. So it's really sad. I wish the original owners of her could see her. I'm going to get emotional just thinking about it, just seeing what she's been through. You have to wonder, what happened to their cat. They have to think about that. But I did get a chance to sit down and meet them in person, the husband and wife, and were able to talk to them. So that had to be some sort of comfort for them. But I just wish that they were able to have some kind of update on their cat. But we love Camille. My husband fell in love with her right away. The kids absolutely love her. She fits right in with us, and she has so much personality. She's amazing. She's strong, and like I said, if it wasn't for the doctors at the referral center, the internal medicine department, she wouldn't be alive. We love Camille.
I think it was amazing during that time how many cats like her we had in the hospital.
We did see a
lined
lot.
up.
And for me, for some reason, she just stood out from the very beginning. I think it was just her personality. Out of all those cats that we saw, she was just, I don't know, something, we bonded.
Yeah, I think I have to always echo what Dr. Hebert said in the talk. I mean, Hurricane Katrina, for those of us from Louisiana, was a very dark time. But through that, I'm sure multiple people have stories. I mean, Dr. Ryan used to work for our clinic. He helped LSU for 3 months. Dr. Kirkison was gone for a month. I was able to get back to the clinic, but the positive story about Camille, just like many people probably in the New Orleans area and the whole south of Louisiana have, is that she's kind of a ray of sunshine through when we think through a dark time, that we can think of a positive story. So, and for me, as a veterinarian, I'm fortunate enough to have Camille's owner work with me every day. So it's a little bit, for me, it's a plus that I get to see Camille often, but also see her owner and see that what a change it made in her life and her family's life. So, thank you.
Yep. Thank you.
What an amazing story. And I know that all of us around the world, but certainly us in the United States, were touched by the Katrina story, because I'm even up in Seattle in the Pacific Northwest, there's Katrina dogs and kitties up there with their beloved new owners, and that's a wonderful story. And it sure shows the importance also of making sure our kitty cats out there, particularly. Hepatic lipidosis is something that can come on really quickly if a kitty cat doesn't eat within a short period of time. Dogs really don't get that syndrome, but pet owners, that kitty cats stop eating, it's really time to see your veterinarian straight away. But wonderful story, and we always love having our feline animal survivors. And actually, they do often come to this event and rule the roost. They are the kings and queens of the whole event, despite the doggies out here. So next up, we're going to go to Bailey. Bailey's our Mastiff therapy dog, and he is owned by Martha and Pete Rawls. And Dr. Liz Kirkojian is an oncologist here. She's with them as well. And so why don't we hear a little bit about Bailey's story? You'll love this big guy.
My name is Pete Rawls. I am one of the co-owners of Bailey, or Bailey owns me, I think.
I'm Martha Rawls. I am a recently retired high school counselor, and now I spend lots of time with my two mastiffs, Bailey and Eve. And Bailey and Eve both are therapy dogs. You know, some people say, well, oh, she's a seeing eye dog. No. A therapy dog is what I call a feel-good dog. They're strictly there to make you feel better, to love you.
She's logged, 434
visits. And each visit is a nursing home. And each one, it may be anywhere from 75 to 150 people. She's around probably 900 to 1,000 people a month. One day, I was at a nursing home. I noticed that she was on her left front foot. She just didn't want to put it down. I immediately took her to the vet. This was on a Friday. He x-rayed it, and he told us, he said, I don't think this looks good. I found a spot that I'm not real happy with, and he says, I just don't think this looks good. He says, but I'm going to refer it to a specialist and see, exactly, what we've got here. So the next day, he called us on a Saturday, and he said, we've got bone cancer. And he said, I want you at the Louisiana Veterinary Referral Clinic next week. And he made an appointment for us.
Osteosarcoma is a primary tumor of bone cells. It's the most common tumor we see in bones of dogs, and it is one that is difficult because it tends to be very invasive to the bone and painful, and also has a really high rate of metastasis to the lungs. We always prepare owners that the most aggressive treatment is to treat the primary tumor with surgery, and most often on the limbs of dogs, surgery means amputation. And then we follow that up with chemotherapy to try to slow the process of metastasis. And she had surgery, I think it was the next day after I met her.
Bailey is a Mastiff, and she's a large dog. And they were very concerned about removing her front leg because Mastiffs carry their weight in the front. The different doctors got together and determined that yes, without question, she would be able to handle it. But it was not because of anything medically. It was because she kept licking them to death. And they knew that she wanted to live. She was very full of life, and I'm not ready to go yet. You know, I've still got jobs to do.
With Bailey's amputation, she did well after surgery, but she was actually fairly slow to get back to normal function.
Of course, it was sad to see her struggling to walk and falling down, and taking a step and falling down. It was just all you could handle.
You know, I said to myself, I don't know if we did the right thing. This is tough, but Dr. Liz and them were right. She got over it. She learned how to handle herself and to get around, and she's enjoying life now.
Right. I don't think she slows down a bit. She can run, she can play. Instead of climbing on the couch 1 foot at a time, we now just jump and lunge on the couch. There's nothing she can't do.
We have many amazing owners that come to us, especially in oncology, and the Morals are just amongst the highest on our list as far as that goes. They're so dedicated. Whenever I ask them, well, what do you think? Are you able to do this? She always says the same thing. She says, I will do whatever you think is best.
I believe with all my heart that Liz Kergesen is a gift from God to Bailey, because Bailey has literally depended upon her for life.
We both firmly believe if it wasn't for her, we would not have Bailey.
Having given us 9 months and we're already finishing 19 months, it says a lot, for the doctors.
Wonderful. Martha and Pete, you want to come up here and let's see if we can get Bailey to stand up. And Dr. Liz, if you want to come up as well.
Well, as Pete said, we don't actually own this dog. She definitely owns us. She is the queen of the house. Whatever she wants, she gets. Whatever she wants to do, she can do. And part of it is because we cherish every single day. As the video said, Liz told us, statistics say we have 9 months. And hopefully, we won't see the cancer back within 9 months. So we were ready. We were ready to do whatever it took. When we were told Bailey had cancer, she gave us options. She said, I can give her pain medicine, and hopefully, we can, last a couple of months. I didn't have the heart to do that. And then she said, well, we could do the radical, and that would be remove a leg. And I was like, remove her leg? Oh my. How can she function? I mean, there's no way. I mean, I've seen dogs with back legs gone, but a front leg, I mean, on a Mastiff, I didn't see how that would be possible. But she convinced us. Liz is a very convincing woman, and she's a great encourager. You can do this, you can do this, trust me, you can do this, and we did. And that was hard, but I think probably the hardest day was the day we brought her home, because we had to load her up into the truck, and you saw her walking up the ramp, and well, she couldn't walk up the ramp, and we had to sort of manhandle her and get her up in the truck, and she couldn't do much for herself. And when we finally got home, my son had to come and help us get her out of the truck. And that's when Pete said, oh, did we do the right thing? I just don't know. And for the first couple of weeks, she would take a step, and she would lose it, and she'd plop down. And we cried a lot, but we got through it. And one thing I learned is, no matter what, I don't feel sorry for her. I celebrate her. I celebrate her life, but I refuse to feel sorry for her because she wouldn't want that, number one, but she's a fighter. She's a registered therapy dog with a Therapy Dog International, and she has, at this point, 455 therapy visits. She sees around 1,000 people a month. She's miraculous. And I've had many people say, why did you do this? To save her life. Pure and simple, to save her life. And what a life she has. Because you should see the excitement about getting to go places. And she is thrilled to be able to get in the truck and go somewhere and see her friends. We call it partying because that's what we do. It's a party. For her birthday last week, we partied. We went to a nursing home and we visited everybody at the nursing home and we partied. And yes, they sang happy birthday to her. So she has an awesome, awesome life because of the help of Brent White, our local vet, but most definitely because he referred us to Liz. And I want you to say a little bit about Bailey.
Well, I would say about Bailey that she is just a trooper. She was kind of slow, and at first she would come in and she had mittens and I guess booties, and she had a harness with a handle, and she needed some help for that first couple of months. But then she came in and she lost the shoes, and she was fine. And then she lost the halter, and she was fine, and she didn't need it anymore. And that was just a few months, and she was great. And that first Thanksgiving after she had her surgery, we were a few months into it, and Miss Rawls is very eloquent and persuasive, as you can see, too. She sat me down in the visit room and, you know, with tears in her eyes, and we are so thankful this Thanksgiving that Bailey's with us and for you, and she made me cry. And then we did it again a year later. We had another Thanksgiving, and that was a while ago. So Bailey's just tough and sweet and a trooper, and really her owners are the exact same way. And she always says, you did this, and she called me last week because I had to work and I wasn't going to come, and she said, I don't want to pressure you. I don't want to give you a guilt trip. But, and then she, about 20
Bailey
minutes,
wanted her here,
told me
right?
I needed to be here. And she was like, because it's all you, but it's not. It's totally them. They were the ones that always said, yes, whatever, we'll come, we'll do whatever. And they're really amazing. So that's what I want to say. And that's all.
Thank you very much, and I hope we got lots of shots of Bailey there. That sounds really good, but we're in New Orleans, for gosh sakes. And I know we see tripods all the time, three-legged doggies. We see three-legged kitty cats. It could be a trauma or it could be a cancer, and they just do amazingly. And I know of one cat in my area that, in fact, for severe trauma only has 2 legs. He has a little cart. There are carts available for the pets, and they've named the cat Trout because it looks like a fish. Next up, we have Penny, the wonderful Labrador down there, with Marcy and Ryan Schneider are her owners. Carolyn Goutal and Kirk Ryan from Louisiana State University were involved in her care. We, as you guys folks see today, we have referral specialists and small referral practices, as well as our College of Veterinary Medicine here at Louisiana State University. So without further ado, Penny.
Penny, you get the paper? You get the paper? Let's get the paper. Go get it. Come on. Atta girl. Atta girl. Thank you.
My name is Ryan Schneider.
And I'm Marcy Schneider, and this is our dog Penny. She's full of energy all the time, loves to play. She loves to retrieve. She's a trained retrieving dog. She retrieves ducks on duck hunts. She likes to throw the frisbee.
The typical man's best friend type animal that just does everything to please us. Well, it's kind of an unusual situation in that we brought her to the doctor for a different procedure, a spay procedure. The problem occurred there as a result of the medication she was taking.
She couldn't keep any food down.
Yeah.
She wasn't eating normally. and they knew after about 2 days that that wasn't right. So they opened her back up, and that's when they found the ulcer.
It was caused from the medication she was on. This is equivalent of like an Advil. Less than 1% have an ulcer. So it's just like such a rare instance. The gastric ulcer perforated, and it caused the contents of the stomach to leak into the abdomen. And so that's when the abdomen went septic. And the peritonitis is the inflammation of the stomach lining and all the organs. So septic peritonitis. And our vet has a very good relationship with the place of referral, which is the LSU Vet Hospital.
That was our only option at that point. He said it was take her to ICU so she can have around-the-clock care, or there's nothing else I can do for her.
As much as the owner was panicked, we got pretty panicked as well. When she walked through the door, she was barely responsive, could pretty much barely walk as well. The owner had to carry her to the ICU with us. She was close to comatose at that time. She had like significant amounts of vomiting coming out of her mouth, of her nose, so we were definitely extremely worried about her condition when she came in.
I'm convinced that she would have been dead within probably 48 to 72 hours had her condition not been recognized and treated. Because she had a perforating gastric ulcer, that had unleashed a very severe abdominal infection into her abdomen, and that type of systemic severe inflammation is often fatal in dogs.
So her initial treatment was pretty aggressive on arrival for sure. I would say it's pretty similar to what we see with septic peritonitis in human patient. I think the emergency treatment is absolutely crucial. So it's a combination of facing a hypovolemic shock with appropriate fluid therapy as well as really aggressive antibiotic therapy.
The first night, it was like she had probably less than a 50% shot of making it. So 7 o'clock the next morning, we called up and they said that she made it through the night. You know, everything's about as good as you could expect it to be. She continued to slowly get better at the ICU. You know, we hit a bunch of bumps in the road, but everything continually got better and better.
It is amazing to see her now after treatment. She's back to be a happy family dog. I'm sure that anybody who would just meet Penny in the street would not know what happened to her. She's still on treatment because it's not completely resolved. So she's currently on sucralfate, which is a slurry drug that we give. It's pretty much a coat, so that would coat the esophagus and calm the inflammation. She's also on omeprazole, so Prilosec, that is commonly seen in human medicine as well, which is pretty much an antacid.
She's pretty much returned back to normal.
She has no discomfort whatsoever now. All with the exception to the dietary restrictions, she's back to normal. Yeah, quality of life went from not so great, I mean, pretty terrible, to, you know, they slowly brought her back to normal health.
What I really like about Penny's case is the teamwork we had with her referring veterinarian and with the owner, really showing that when everybody works together, we have the ability to take a dog who was essentially hours away from dying and return her to a good state of health where she can have a good, happy, healthy, normal life. You know, she's going to hunt again, she's going to play with children again, she's going to do all the things that she wanted to do and that they wanted her to do before she was sick.
I just want everybody to know how amazing LSU Veterinary Medical Center is.
They treated her like it was a human being coming through those doors.
If it wasn't for them, we wouldn't have our dog and we wouldn't be us.
Good
girl!
So can we bring Penny up here with Marcy and Ryan Shiner? And Dr. Ryan, would you like to come up as well and tell a little bit more story of this amazing dog?
We nominate Ryan to go first.
Yeah. I don't have anything prepared, so I'm just going to let Penny speak for us. No, but seriously, as you can see, this dog is back in perfect health. She went through a pretty rough time there. Luckily, our referring veterinarian had a very good relationship with the LSU vet clinic, and actually is a teacher there. So he ended up bringing Penny to the emergency room ICU to get before we even made it there. And they quickly assessed her condition, and
And it made me really realize how poor our medical treatment here is for humans, because I only wish that when I walked into a hospital that I had the full and undivided attention of every person there. And that, you know, that's how it is at the LSU Veterinary Hospital. And for that, we're very appreciative, because went through some rough times. She was in ICU for a few weeks. I think the real ICU for like 4 or 5 days, and then slowly nursed her back to better health. Because as you can see, she doesn't appear to have anything wrong with her today. Maybe a little ADD, but she looks to be doing pretty well. I don't know, do you want to say something?
Hi, Penny. All right. Well, just wanted to thank Marcy and Ryan for bringing Penny. She's, you know, not the easiest patient to cart around. It seems like that's pretty common, actually. That's a pretty heavy dog there. She's doing great. And I just thought I would mention a couple of things that were mentioned by some of the previous speakers. One is I think you guys had mentioned the value of pet insurance, and she's got pet insurance, and my dogs have pet insurance, and it's been really rewarding to have that. And then the other, I think folks had mentioned one of the things is the teamwork with the referring veterinarians. And Penny's referring veterinarian did an excellent job. He actually did the surgery that saved her life. She had a lot of complications, and she needed a lot of critical care. And we got her over several obstacles after that. And she still is in treatment. She still has some issues eating, you know, well, if we let her, she would eat anything she wanted to. But she's not able to do that. But that kind of teamwork with her referring veterinarian in our hospital, and then also with the Schneider family, you know, Penny's obviously doing great. So she's probably my favorite patient, and I'm really glad to see her here today. Anyway.
We have the LSU Veterinary Hospital to thank for her life, because at that point, after she left the vet's office, after her spay surgery, they told us that we either send her to LSU or that was it. So we completely trusted them, and they are fully responsible for her life, and we're so thankful for that. So that's it. Now she's sitting still.
Now she sits still.
Thank you very, very much. The triangle of care with the 3 partners circling the pet is really, really important. And, you know, I know the pet owners sometimes will listen to these stories and boy, that sure seems like a lot of money, and the pet insurance is a great avenue to help with that. The other thing, though, is that sometimes animals are referred a little bit later rather than sooner, and if they're referred a bit sooner, overall the cost may not be as expensive, because what we're trying to do is find out, with the additional expertise of a specialist and equipment, what the problem may be and sooner address it. So sometimes in the long run it may be a little more expensive, but the sooner we see the patient, it is not as bad as one would imagine. And I love Penny's story, because sometimes it is 24-hour care, acute renal failure, dialysis. There's some of these that does that 24-hour care. A generalist just isn't able to provide. They're the jack of all trades. They see so many patients in a day, and that one-on-one care that an animal such as Penny would need really needs to come from a referral center, or such as Louisiana State or a referral veterinary practice with the teamwork. As you've seen, there was a technician up here. We have technicians here at our meeting. They are our veterinary nurses, and we couldn't do the work without them. Our last and biggest animal survivor today is Rocky, and Rocky is one of the horses from the New Orleans Police Department. There was a respiratory outbreak due to an allergic source. I'm not sure if we have one of the officers here, but we do have Dr. Frank Andrews and Dr. Rebecca McConico from the Large Animal Internal Medicine at Louisiana State University. We'll have them come up in a moment, but let's hear about Rocky's story.
We use horses for a number of reasons. Our main purpose is crowd control and mostly a deterrent on Bourbon Street, mostly during Mardi Gras, New Year's, and special events that draws a lot of crowd down in the CBD. My name's Dave Wagasback. I'm a New Orleans policeman assigned to the New Orleans Police Department's mounted unit. I've been a policeman 25 years. I've been assigned to the mounted unit the last 20. To work the crowd on Bourbon Street, to go down Bourbon Street on a horse and do the police work from the horse is very unique and it's very satisfying. It's something you got to want to do though. It's not just jumping on the back of a horse and going down Bourbon Street. They're very, very, very powerful animals, so I respect them very much. Yeah, so this horse is named Rocky. We got him in 1998. He's 18 years old now, and we've been using him ever since. Well, about in 2010, a few of the horses, including Rocky, developed a cough where he was panting and he was having trouble breathing or something. So then I contacted our contracted veterinarian, Dr. Allison Barker.
When I got there, I realized that they were suffering from chronic obstructive pulmonary disease. It was more than just a few, it was more like 5 to 8, all at the same time. I had never seen that many horses break with that problem all at once. It's usually an individual problem. So I was pretty upset by this. I figured that there must be a serious environmental cause. And again, there's Katrina to always worry about. We're worried about mold. And if the officers themselves were not in some degree of danger, if this many horses could have a problem on the same day, are we not all in danger is something in the environment that we needed to fear. I wanted some help for this, and I'm fortunate once again that we're only an hour from Louisiana State University's vet school. I can pick up the phone any time of day or night and call Dr. Andrews, Dr. McConico, Dr. Chapman, anybody pretty much at LSU when I need help, and there's no question they will come to my aid. So I always feel like I'm working in a huge practice, and I'm just one of a team of people. And that's how I feel, and that's how it is.
Recurrent airway obstruction, which is what we call RAO, has the common public would know it as chronic obstructive pulmonary disease, or COPD. It's similar to asthma in that its inciting cause is probably some allergens in either dust or mold, either in the hay or in the environment in which the horse is breathing.
Dr. Barker is one of our good referring veterinarians, and she's been in practice for a long time, so we knew when she called there was probably a pretty important case that she wanted us to see.
There was concern about environmental things. It was post-Katrina, a couple of years post-Katrina. They were worried about black mold.
In August of 2005, when Hurricane Katrina hit New Orleans, a good portion of my practice was damaged pretty severely. We lost a tremendous number of horses to death due to the storm, people who were not able to get out, people who lost their homes that had to leave the state and move to other areas, and then entire barns were lost because they were on public property that had to be turned over to the government for FEMA trailer parking, which is where a lot of people had to live when they lost their homes.
We were a triage hospital because we're an hour from New Orleans. We were the ones that received the influx or the wave of people and animals. So our teaching hospital received many of the storm victims.
The NOPD stables are located in City Park. And during Katrina, one of the levees broke near the park and flooded the park. We had about 8 to 10 feet of water in our stables. If we would not have left, we probably would have lost all our mounts, and that would have been a disaster.
When you have a whole group of horses that develop this RAO, then you're concerned that there's something in the environment that's causing reaction in the airway. So we need to come out and evaluate the cause of that. Dr. Chapman, our ambulatory veterinarian, who is also an ACVIM diplomate, she came out and helped Dr. Barker identify why these horses were having that particular problem.
We did complete physical examinations with our students. Most of the horses we did hear a lot of abnormal lung sounds.
We took some samples out of the horse's lungs. We actually flushed some water down into the lung and aspirated back. We were able to determine that there was allergy-associated disease. So what we did is we changed the horses over to an alfalfa hay diet so that the horses would not be exposed to the dust in the feed at least.
And then we were able to get them on a management protocol that included anti-inflammatories, non-steroidals, some antibiotics, and with additional follow-up, we were able to wean them off of the anti-inflammatories to where they could recover for a few weeks longer and get back on the street and do their job.
After the treatment, they seem normal. They seem to go back to normal, go back to work, their regular work schedule, and they're all fine. They haven't had any problems since.
We actually came down to do a follow-up on the horses after they received the treatment. With the changes we made and with the therapy, the horses improved and turned around, went back to work, back on the job.
If you could ever be in New Orleans for Mardi Gras and see the thousands of throngs of people so thick that you cannot walk through to get a Coke, all you have to do is have one horse come down the middle of the street. It's like the parting of the Red Sea. People respect them. They're a little afraid of them. And when you put an officer up on a big, tall, percher-on animal like that, you clear a crowd faster than you can with a police car. People have no respect for police cars, but they have plenty of respect for a police horse.
The NOPD horses are treated very well. If we take care of them, they'll take care of us. For the most part, we treat them like kings. They get fed sweet feed twice a day. They get free choice of hay, free choice of free water. Their stalls get cleaned on a daily basis. Again, we got to treat the horse good and they'll treat us good.
And that's Rocky's wonderful story. If any of you guys have been down on Bourbon Street, the horses are truly magnificent, and they do command a lot of respect and a lot of photos from the crowd passing by. Dr. Zander or McConico, do you want to come up here and say a few words? Thank you.
I'm a little bit, I just have to apologize. Dr. Barca called me. I called her yesterday. She said she has the worst respiratory disease she's had. I hope she wasn't with the horses. The worst respiratory disease she's had in about 2 years. So she is sick, and then Dr. Chapman is not here. So I have to. They are the real, other than the horses, they're the real heroes in this particular outbreak. We really appreciate the relationship we have with Dr. Barca. And the teamwork, and obviously she's an LSU grad, so with her help and getting us on site early, having a look at these horses, and again, our goal in all of this is to get the horses back to work, and that's the main thing. Is if you get a chance to go on Bourbon Street and watch these horses work. In their environment, it's incredible. And one of the things that Dr. Barca talks about is that when a car drives through the French Quarter, people they're not concerned about a car. But if you put a horse through the French Quarter, people part like the Red Sea. So it's incredible to watch these horses work, and the people. The police officers that work with these horses. So as our goal is to get the horses back to work, and they did. The group did an excellent job. And of course, without the police, the policemen, and the New Orleans group, being receptive to treatments, and working as a team, and we would have never got this done. So we really thank the police department and Dr. Barca and Dr. Chapman for all their hard work and teamwork in getting these horses back on the street. Usually, I like to keep your kids off the street and the horses on the street. So.
Just, since I get to be the one of the last ones to speak, I just want to say how proud I am to be a part of this amazing specialty of internal medicine, and especially of Louisiana veterinarians, the practitioners that came back after Katrina. Truly amazing people, a wonderful bond that we all share all together, small, large animal, local veterinarians, specialists, everybody all together, the owners. We're just all a big team, and we appreciate being a part of this with internal medicine, and really appreciate that you took the time, the effort to put these stories together. It was really an honor to be a part of it.
Thank you very much, and to all our animal survivors here. What an amazing set of stories. Again, this has been our 12th annual year of doing this at the Forum. Next year, we're in Seattle, Washington, my hometown, and I'm very excited about the animal survivors we'll have next year. This all is about the pet owners, they're wonderful specialists, and the pets telling the story about referral veterinary medicine. It's important that pet owners understand that they can ask their veterinarian for a referral to a specialist. They can find local specialists in their area at our wonderful website, www.acvim.org. The logos you've seen up here are two. One is of the ACVIM, but the other one is our giving arm, the ACVM Foundation. That's our nonprofit organization that was founded and created in 2000. And donations to the ACVM Foundation help fund our programs of research, education, advocacy, and service. And if you're interested in helping specialists or your pet has benefited from the help of a specialist, it's a great place to donate in the name of your referring veterinarian, your specialist, a beloved family member, including your pet. A few years ago, my cat was seen by a colleague of mine in internal medicine in Tacoma, and even though Ack didn't live, she had severe renal disease at 21 years of age, I donated to the foundation on her behalf, and it's ways that we can all, as pet owners, help future animals benefit from the research being done in the American College of Veterinary Internal Medicine. And that wonderful website is www.acvimfoundation.org. I want to close by thanking everybody for their time and coming out here and taking the time out. Specialists, our pets are having a wonderful time with their new little handkerchiefs around their necks, collars around their necks, and these wonderful pet owners are telling the story so eloquently, that couldn't be told any way better. And again, to find a specialist and learn more about us at acvim.org. And again, I want to thank the individuals that were involved in making these great videos. They're just wonderful. So we invite you to come up afterwards and meet our pet owners and their pets and ask them any further questions. But thank you very much for coming out for Animal Survivor.